Hey, everybody, it is Kevin and Thea, the star of our show, the Remote Care Services Show. And so today we have a fun episode for you. Last week we talked a little bit about the basics and some of the understanding, but today we're diving into something that I feel like is just a general fear, Thea, that you and I have talked about before, that folks are just like, it's going to take a lot of time, or it's really hard, or it's something that I've never done before. But focusing on the time piece, like what the commitments are, what some of the elements are. I know there's, kind of the alphabet soup we talked about, but kind of looking at remote patient monitoring, chronic care management, those two in particular, like what is the time involved in? What do you have to do?
Okay, that's a great place to start. I think, as you know, most pharmacists and pharmacy owners don't have a lot of time. So they're thinking, how can I add something more to this? So I'll start with just being a consultant, as I did, independent consultant for long-term care, or for not long-term care. How about primary care, outpatient primary care, ambulatory primary care? And that time commitment, I was able to build my practice around a 9 to 5 job. So I was working 40 hours a week. And I found the education, and it took me, because I didn't have a mentor that had done this particular work. I had help in finding, what the program was, what the requirements were, that kind of help. But I didn't have someone ahead of me in the journey. So I had to start at the beginning and really just do grassroots talking to doctors, like going and talking to them, what that looks like. I would say out of all things, that is the hardest and the most time commitment, because it does take daylight hours, right? So building it as a 40-hour job, in addition to a 40-hour job, it was very taxing. I took a lot of lunch breaks and made phone calls, and, grabbed a luncheon here and there using a little personal time from the 9 to 5. But I was able to secure that contract with some finesse. And it took probably 3 months or so of nurturing that position. So when we talk about all things, these programs are great. They offer a lot of revenue. But the one factor, we have a gatekeeper. And I continue to work around that gatekeeper as much as I can and try to think outside the blocks around that, because the service is really needed by the community. And so when we look at the time commitment for the overall program, like, okay, I'm going to start doing this tomorrow. What does that time commitment look like? I will stress over and over and over again, do not quit your full-time job. Do not quit, because it is going to take some time. It's all about the timing of the doctor. So I know you wanted to dive in, how much time does it take me? But I want to start there, because it really is the factor that's the hardest to do. But with the correct mentorship, I feel like I take the variables out of, I don't know what to say, or I'm afraid to say that, or I have nothing in common with this doctor. And I take it back to, especially pharmacy owners, or pharmacists in community pharmacies. I look at, how many patients do you have in common? And then how many blood pressure patients do you have in common? How many diabetes patients do you have in common? How many of those people are compliant and adherent? So you do have something to talk about. You just got to train your brain to think a little bit differently, other than, I don't know this doctor. Oh my gosh, I can't do a collaboration. I know nothing about a collaboration. And oh my gosh, I don't have any more time. So let's take a look at the time on that. I'll come back to the time on, okay, once you've got a doctor signed up for the program, the timing it takes is a 20-minute phone call each month with each patient. Now, some patients could go up to an hour for sure. Sometimes that collaboration time is with the doctor, finding out answers or offering resources to the patient. But don't you do that already in retail? Just wondering. Because I think maybe from the time I was in retail, both in big box store as well as independent retail, still today, I find myself offering a lot of resources. Sometimes it's about things that I know about. Sometimes it's about getting on Google, looking it up, and trying to figure out how to help them, and not letting them go to Google and be Google MD, but really find the valuable resources and things that they're going to need for that time. Whoa, I just got a little bigger. Hi, Kevin.
Zoomed in. No, I think with the zoom in, wow, what a segue here. But again, I guess, to that piece you're talking about, really getting into the doctor detailing, as some people have said. I love that you say it doesn't have to be an intimidating process. I mean, it's interesting because It literally is like our kids are playing on the same soccer team or hockey team in Thea's case.
Yeah.
We just want them to succeed, just want them to be successful, and we can find ways to be able to collaborate to do so, then hey, fantastic. It doesn't have to be an intimidating conversation. You're already working with them in one way or capacity if that's possible for you already. So I love that. And I think when it comes to, the rest of this episode, like we can talk about the time later, like the time commitment overall on like, what does it take to be able to get into the charge, to contact patients, to X, Y, and Z. But just focusing here, since we've kind of segued to, this conversation of what does it take to just get it off the ground? I think that's curious, Thea. You mentioned right off the bat, like you got to be able to know doctors, right? The other piece that I'm wondering when you're doing all of the back end research is not just getting those doctors to say like, I like Thea, she's smart, she's going to help my patients, but they care about something else, and that is how much time is it going to take me? What does it take to actually bill for this service, and what's the return on investment for my overall time? And so I think that's the other piece that I think is really curious when we're looking to do sales, go from pharmacy into sales, is gearing our brains to know that there has to be something in it for the other party, the
Right.
other folks involved. So tell us more about that, Thea. Like what has your experience been in those conversations? Like off the bat, is it really you're focusing on the clinical details? You're focusing on how much time I'm going to save you? When are you segueing and being able to say like, here's the true finances behind, what we're going to be able to partner to do together?
Yeah, doctors like to be hit in the face with that more times than not. What I've seen is that they want to know what's in it for them. And if you bring that to the table and say, okay, I've done my homework. I have 13 patients of yours on my DM program, 5 of which are not compliant. I have this new program that allows me to be a little more compliant with my medication refills. And I feel like we could take that a step further and really offer a service collaboratively as, chronic care management, remote patient monitoring, transition of care, behavioral health. Okay, diabetes and behavioral health, we'll call it there, but we'll stop there. But I feel like there's plenty of ways to segue right into, especially when you do the research and say, you have 13 patients and only 5 are getting refills correctly. I'm losing money. You're losing money. You're going to dive into these quality metrics again. The quality metrics are exactly the thing that the physician needs to hear about right now. Quality metrics are across all boards of insurance. If they take insurance, they have to play the game. And I just read, who was it? Prevounce, I think, put out a software company, put out a blog yesterday about only 25% of primary care physicians are using technology to help them.
Wow.
25%. So, and I think the number was 75% or 85%. I can't remember off the top of my head, that said that it's valuable and they've leaned on it for during the COVID pandemic, but only 25 are doing it today. Plenty of room at the table for us to show up, hold some hands around those diabetic patients, because those diabetic patients are your heavy hitters, right? Those are the ones that are having the Trulicity and the Ozempics and all of the others that they're not coming back in every 28 days to get refilled. So you need them to be able to, pull that refill in to get your money for it. Not everything you're making money on, but that one you probably are. And so go ahead.
No, I was just going to say, so this, it really is a process, you working with them. And you said in the beginning, like one of the first kind of doctors you converted over, or clinics you were able to switch over to utilizing you, was a 3-month kind of process. So if you're looking for conversion rates, Thea, like we're thinking in our minds, this is how long it's going to take me for the typical, relationship, not something that's already like literally like you're talking to your brother down the street, that is a physician, and like that conversion rate, or you're talking to someone that has refused you multiple times for other offers, but the typical standard kind of relationship. What do you feel like that time dedication is for like number of meetings on average and amount of time that it's going to take to be able to move someone from idea to starting the program?
Usually you can't get in the door without sharing your idea. So you have to share the idea at the beginning. What I try to do is I send out, feelers. I call the office, talk to the office manager, see what they're struggling with. And then I go on and say, okay, when can I get in to bring you lunch? And we'll do lunch and we'll talk. And it's going to be 3 or 4 weeks. Okay. Would you mind if I sent you some updates and some information that backs this up? I have a few case studies and some marketing material. Can I send that to you? Absolutely. Go ahead. I'll get that in there, and we'll keep, nurturing, right? We're nurturing, even though I had to wait 4 weeks to get in to bring them lunch, whatever. And so that's my nurture time. I go in. I don't ever have a contract in hand when I go in, because I want to listen to what they have to say. I want to listen to how it's the active listening pharmacists know how to do. We're fixers by nature. I don't care. Most pharmacists are fixers by nature. We're like Tinkerbells, and we're all tinkering around, and then poof, we've got something special for you, and we're going to fix a problem. And most of the time I started with physicians that I knew struggled with help in their office. And right now, I don't care where you are across the country, everyone's struggling for help in their office. So looking at that, I said, okay, I'm going to start with these offices. I reached out to them, set up appointments after the fact. So I had a great luncheon. They're very interested. They want to see the contract. That's another 2 or 3 weeks. So you really are about 2 months just nurturing, getting in for that luncheon, and then being able to produce a contract of what that looks like. Now, some call it a collaborative business agreement. Some call them contracts. I like service agreements, because service agreements are exactly that. You pay a service agreement to have your telephone. You have a service agreement for your platform and your pharmacy. You have a service agreement for all of these things monthly. And that's what this is. It's a one and done, usually about a year, maybe 2 years service agreement that just lines out that says, hey, Dr. Smith, I want to do these services for you. And these services may be refills, maybe prior authorizations, maybe chronic care management, and a list out all the things you can do for them, all of them. Nice. But you're really only going to work on one. But once they find out who you are and how you're going to show up to this game, they're going to want more, because they're going to need more help. Once you show that you're in it for the long haul and about getting patient results, which drive the money, which drives the metrics, which drives the doctor's happiness. So I feel like, it does take some time on the front end to get this set up. Like, if Dr. Smith, because they're on the hockey team and you're, with them and around them, and they love the idea, that's a slam dunk home run. Start with there. Yep. But when you are like looking at setting up the program, from that point, you get a signed contract to get to the IT section, through the IT section, being able to access electronic health records and picking a platform and that kind of stuff. That probably takes 2 weeks. So you really are about that 3 weeks time frame to get this off the ground. Yes. With the doctor's conversation, though, a lot of people are like, I don't know what to say. Thea, can you come do this for me? I get that all the time. I'm like, I could, but then it would be my service and not yours. So I think I'm going to give you everything I can to make this your service. Because realistically, it is about helping the patient and helping offload the burden of that high need patient on the doctor. Yes, the doctor wants to spend time with them, but they get 15 minutes. 15 minutes, Mrs. Smith is not done asking all our questions in 15 minutes for some. So, looking at that and what that looks like for the physician, when I say ask them like what their questions are. Well, I have these, diabetic patients who aren't meeting their A1Cs of under 9. I'm like, okay, well, let's start there. Let's look at that. I brought in that you have 5 patients at my pharmacy alone that aren't getting refills regularly. So I would venture a guess, if we looked at their A1Cs, they're going to be some of those patients that are a little bit higher on that A1C level. So, can we start there? Can we start with the sample patients of the metric? It may be the metric of just medication adherence. So let's see, provider offices are usually tasked with medication adherence around hypertension, cholesterol, and diabetes. Those are the 3 medication adherence measures that the physician offices, whether in a hospital system or out, primary by themselves, they're going to be tasked with those. And those are triple weighted measures. So that means 3 times the effort needs to be spent on those patients. And when you look at what you can do as a pharmacy to help that, well, obviously there's lots you can do. You're in the business of getting their meds on time for them. So that's an easy win for you.
Well, Thea, that'd be amazing. Maybe that's what we can plug in today for our, here's our teaser. Thea just went over a ton of stuff for you guys to be able to see, here's how much time it actually takes to just get started, in the first point. So you can have a realistic understanding of what you need to do. And then the other pieces that Thea will plug into her channel are just, here are the common pain points for providers that you're going to encounter, for you to be able to kind of address. Then you guys can ask Thea questions there. So always exciting. Another wonderful episode, Thea. And everybody, we will see you inside of Thea's Remote Care Services channel inside of RPH Ally. Look forward to having you there, and we'll talk to you soon.